Birth can go to plan or not to plan, and you may decide at some point along the line that you do want pain relief, an induction or another form of procedure. The most important thing is not to feel like you have failed if anything prevents you from having what you consider to be your ideal natural birth. The single most important thing is that whatever choice you make is yours. This is why it's so crucial to understand your options and your rights. If you do want pain relief, make sure you are aware of what pain relief is available in your setting. At home, you can use a TENS machine, which is a small handheld device that you attach to your body with small pads. It uses electrical impulses to help dull painful sensations, and it can't be used in water. The midwives will bring us an air. If you want any other form of pain relief, you will need to transfer into hospital. In a birth centre, in addition to water and your own TENS machine, you will also have the option of some form of injected opiate. These help with general relaxation and may make you feel slightly drunk. Not all women like the sensation, especially as it can cause nausea. These drugs can also make your baby sleepier and slower to start breastfeeding. If given too close to delivery, it can also impact baby's breathing, which is then reversed with another drug. It's best to talk to your midwife about whether these drugs are right for you. In a labour ward, you will also have the option of an epidural. You can only have an epidural in a labour ward. You can't have one at home or in a birth centre because it needs to be administered by an anaesthetist. After an epidural, you will have limited use of your legs and your baby will need to be monitored. This means your movement will be restricted, although some hospitals offer what they call a mobile epidural. With an epidural, you may not feel the urge to push, so you will need to be directed by a midwife. And it's likely that ventouse or forceps will need to be used to pull your baby out. This means you may also need an episiotomy, so you can see how one intervention can lead to another. Remember that hypnobirthing will teach you techniques to manage pain so that you can cope better at home, or if medical pain relief is not available to you when you need it. For example, if your labour is quicker than expected, or if an anaesthetist is not available when an epidural needs to be administered. So as part of your birth preparation, make sure you really understand the pros and cons of the various forms of pain relief and what is available in your chosen birth setting, so that if it comes to a point where you feel you need some help, you know exactly what to expect. I have left some links to further information about pain relief options below this video.